All right, so right now what we're going to talk about briefly is I want to talk about what we can do as far as feeding when we are not eating by mouth. So this is basically going to be the nursing process for NG tubes, for gastro G tubes, gastrostomy tubes, and things like that. I'll briefly touch on a little bit of total parental nutrition and TPN. But first of all, with an NG tube or a nasogastric tube, once we put that down into the stomach, before you access it, it's going to be very important that you make sure that it is in the proper position and in the proper place. In your book, there is a detailed description of the skill for putting down an NG tube, which you measure it from the tip of the nose to the earlobe and then down to the xiphoid process. Once you measure it down in that area, then what you're going to need to do is tape it and secure it so that it doesn't move or go anywhere. What's the best way for checking placement? Well, obviously the best way for checking placement is going to be with an x-ray. But if you cannot x-ray, remember a nurse always needs to have at least 2 methods to verify placement before using any type of internal feeding tube. Now, there's different types of internal feeding tubes, but the methods of checking placement are always going to be the same. X-ray is the best. We can also check for gastric aspirate, meaning pull back to see if you get any stomach contents. You can also instill a little bit of air and see if you hear the air in the stomach. If you don't, that could also mean that it's in a place that it's not supposed to be. And then lastly would be checking the pH. So x-ray first, possibly aspirating gastric aspirate, and then also putting the air into the stomach or the aspirate back in, and then checking the pH. And that goes for a nasogastric tube or a gastrostomy tube. Always important to check placement. Another thing that we want to make sure that we're doing is when we're giving anything, whether it be a feeding or medication, that we're flushing the tube appropriately. There's a term that they use in nursing. Basically what you're doing is you're taking 30 to 60 milliliters of sterile water or just even tap water and flushing the tube with it. What you're doing is you're checking for patency, making sure that the tube is open so that the formula or the feeding or the medication that you're putting in the tube is going to go down effectively. Okay? Couple other things, just when you're tube feeding a patient, you should always remember that you want to position the patient so that they can digest it properly. So they need to be either in a semi-Fowler's, which is a minimum of 30 degrees elevated, or a high Fowler's position, but always make sure that they have their head of the bed elevated so that they decrease the risk for aspiration, decrease the risk for choking, and help the formula metabolize and go through the GI tract. Okay, another type of feeding is TPN, or total parental nutrition. When would we give total parental nutrition? We would give it when a patient is NPO, when a patient needs some extra calories for healing of a wound, or possibly even a burn patient that there's no way that they can consume all the calories that they need. Remember in the previous lecture I talked about protein and carbohydrates and how proteins are used to build tissue. You need an enormous amount of proteins to help heal an injury or a wound, especially somebody who's been in a house fire. Okay, so what do we need to know about TPN? Well, let's talk about the nursing process for just a minute with TPN. With TPN, you administer it over 24 hours, sometimes 12 hours, but more likely 24 hours. Remember, everything has a range in nursing. So you're going to want to make sure that you change that bag a minimum of every 24 hours. TPN has a high glucose content. Automatically, there's always going to be a lot of sugar in the TPN, so you want to make sure that when you have a patient on TPN, whether or not they're at high risk for diabetes or whatnot, you're still going to need to make sure that you check their blood glucose level, because there are so many things other than diabetes or illness that can increase our blood glucose level. And we're going to get into that later on when we talk about disease processes. But for right now, keep in mind that blood glucose levels can be altered by surgery, they can be altered by stress, they can be altered by injury, they can be altered by TPN and different medications that we're giving the patient as well. What else about TPN? It is administered intravenously, so you also have to look out and assess for any intravenous complications, which you will learn about mostly in IV therapy. The other thing with TPN is there's, as far as the nursing process goes, is you know that you're not going to be mixing any medications in with the TPN. Okay. Before, on the previous video, when I was talking to you guys about different types of nutrients, such as vitamins and minerals and things like that, we talked a little bit about diets. One of the things that we didn't really touch a whole lot on was different types of cultural diets. And I think it would be helpful also if you went and reviewed some different types of things that maybe you would consider for a cultural diet. For example, some of the cultures that come to mind: Muslim, possibly Hispanic, Asian, what else? There are also people that are on vegan diets or vegetarian diets, and there are, oh, I can't think of it right now, but there is another diet where maybe just somebody of a certain culture just refuses to eat meat of certain kind or whatnot. But keep that in mind. And when you're studying for your exams and you're looking over things, look at the cultural considerations and review, you know, what's important in certain cultures. Honestly, that's something that I'm not great in. I'm not really up to speed that much on a lot of cultural diets, but I know that throughout the program, you're really going to have to focus on cultural changes as well as nutrition all throughout, even though there's not a course specifically on that. So I just wanted to talk about that. And then lastly, disease processes. I know this is fundamentals and we're not going to get into a lot of disease processes, but let's talk about some disease processes that possibly are affected by nutrition. Some of the disease processes, and some of these may be in your book and some may not. One is anorexia. And anorexia, you should know, anorexia nervosa is a disease where the person really limits their intake and suffers from nutritional deficits because of it. And somebody who has anorexia nervosa, as well as another disease that goes along with that, is bulimia. And bulimia is different. Bulimia is more when they binge eat and then they go and throw up, or not only do they binge eat and go and throw up, but they could possibly even eat and then abuse laxatives and cause themselves to have severe diarrhea to get rid of the excess food and fluid and calories so that it doesn't maintain fat stores in their body. Another type of thing that you might see with nutrition is in infants is something called FTT, which is failure to thrive. That's just also another disease or an illness, basically condition, that is based on a nutritional status. And then there are patients that are lactose intolerant, and those that are lactose intolerant cannot tolerate dairy products. So you really have to think about, if you're asked to provide education and patient teaching for somebody who suddenly develops a lactose intolerance, what are the things that they can have that can fulfill that dairy need that is in the pie chart for your nutritional supplements. So I know this was brief. I'm going to try to limit these little tutorials to about 15 minutes, but I just wanted to go over a little bit more as far as those types of feeding mechanisms for this unit. And I will catch you on the next one.